I'm honored by the invitation, and I will give you just initially a few words about the Health Consumer Powerhouse, what we do and why we do it, and then I will guide you through a few slides presenting some remarks on Greek healthcare, what we notice and what we'd like to stress when we compare Greece to all the other European healthcare systems. I founded the Health Consumer Powerhouse 10 years ago, and since then we've been active in measuring, comparing the performance of healthcare systems. And our EuroHealth Consumer Index, the EHCI, has become, you can say, a standard for well-serving modern healthcare in Europe, and we often also include other parts of the world, Canada, for example, in our measurements. We do this because we strongly believe that openness and transparency drives development. It does, we know, in large part of any industry. And of course, in healthcare, which is a very complex system, you should use the same kind of tools. Nobody wants to stay in the bottom of these kind of comparisons. There's lessons to learn from the best performers, and we know that to individuals, to citizens, to patients, it's important to have a view of the performance of healthcare in their own country. What can you learn from other systems, especially in the time of increasing cross-border mobility? As you know, you have, as a member or citizen of any member state in the European Union, you have the opportunity and the right even to go cross borders to achieve treatments. What does this score, this comparison tell us? We do this on an annual basis, and we include the whole of the European Union and also countries on the way into the Union. We also include Norway and Switzerland. And you notice that in the right end, you have the top performers. To us, Netherlands is close to the ideal. And then you have a falling rank, and you find Greece on 568 out of totally potential 1,000 points on to the left on the screen. And if you just look upon the scoring, and here we include a number of elements when we build this comparison and the rank. We look into patient rights and access to information. We look into what's covered by the public offering, how generous is the system. We look into prevention. We look into the outcomes, of course, central, what does the healthcare deliver in case of treatment and so on. And we also look into access to pharmaceuticals. So we try to give an overall picture. What we don't look into, which is important, is policies and different kind of political proclamations and different kind of announcements. It's easy for any government to announce big reform or declare that you will support gender equality or support prevention or whatever it is, and then nothing really happens. We look into what's really delivered. What can you measure? What is there in form of data? So when we build this overall ranking, we look into the outcomes. We look in also into the value for money performance. And if I interpreted the minister right, one of his key goals is to improve the performance in Greek healthcare when it comes to the value for money. I will come back to that. Important also, not the least when you look into the Greek healthcare, is the balance between the components of the system, meaning that you if you pay too much attention, too generous, spend too much money on, let's say, accessibility. Take Belgium, for example. Belgium is a European leader in access. It's very easy to see a doctor the same day or maybe the next day. You don't have to wait many days for an operation and so on. But the outcomes, the quality, hygiene in hospitals, etc., is less favorable. So maybe that system is too focused on good access, but maybe doesn't really value other parts of the healthcare system. That goes for many systems, and when you look into the Greek system, it's quite evident that there has been, still is probably, especially been, a profile that's worrisome and complicates the overall performance. I will explain what I mean in a minute about that. Also, patient views, patient satisfaction is essential. You can't anymore build and drive a healthcare system in Europe or in any developed country, I would say, without paying a lot of attention to the attitudes and the expectations, the satisfaction and dissatisfaction, of course, among patients. Time is over when you can run a top-down system, paternalistic, saying that the doctor knows best. Now there are different times, and you need to take that into regard. How much money you spend on healthcare, of course, is essential, but far from the only explanation if you perform in a strong or weak way. Some in the end of the right end of the chart, there are some wealthy countries spending a lot of money on healthcare. Some of them quite successful. They combine a lot of spending with good outcomes. Some spend too much compared to what they will achieve. I will come back to that. And in the low end, you find poor countries spending quite little. We have Greece a little to the left of the middle, and then you should understand that as a comment to the panel discussion here about cuts in the healthcare budget of Greece. Between 2009 and 2011, these are 2011 figures, the latest available, there was a dramatic cut, 28% cut of the total spending per capita in Greece. And that's rather dramatic. Greece is far from the only country suffering from this kind of financial crunch. You can see whole of the Baltic, for example. You can see Spain, Portugal, some of Czechoslovakia, former Czechoslovakia, that is today Slovakia and the Czech Republic, etc. But they've been cut down in the level of 10%, so 28% is rather dramatic. So if you look upon the situation before 2009, when the crisis really started to make an impact, you should understand that Greece was in the same spending level as Sweden or UK, for example, United Kingdom. So Greece has been a rather high spender. Now things are different, of course. But as I said, money is just a part of this. It's more interesting would be to look into what we call a bang for the buck adjusted score. And I heard, if I understood the minister, he used the same terminology. This means that we relate the overall performance that I showed you in this yellow-blue chart to start with. We relate the performance, the overall scoring, to how much money do you use to achieve these goals. And then the picture is rather different. Means that in the to the right you find some countries that are doing fairly well, but not absolutely in the top. in the overall scoring. You notice Croatia, Czech Republic, Estonia. We've been through a severe crisis but not recovered. Lithuania, etc. You find Netherlands rather high in the bang for the buck score, meaning that they have a quite expensive system, but they also deliver quite well. Then in the middle, you might find some countries maybe a little more surprising. You find Sweden, for example, or UK, Norway, which has a rather good system nowadays, but have been spending a lot on getting there. So the more further to the left you get, the less value do you get out your investments or the spending on healthcare. And as you notice, you find Greece far to the left, third from bottom. And that is an indication. You should understand that this is a tool you can use to detect strange combinations, strange effects and so on. This is part of the truth, but not the truth. So, but when we notice that Greece is close to the bottom here and still has been spending a lot of money on healthcare, you should, as a reformer, always ask yourself, what's behind this? How come that you have such a poor bang for the buck, value for money performance? And now we're close, approaching the essence of this discussion, I would say. I will try to stay with facts and conclusions that we can draw from our 10 years measurements, and I will stay away from more overall speculation about the political involvement or how you form the administration, bureaucracy guiding the Greek healthcare system and so on. That would take my lecture up till lunch, and if I should try to keep within 15 minutes, I will look into a few key findings. And if you look upon, it's always wise to look abroad to successful and maybe also less successful examples of reform when you try to shape up a healthcare system. There's reform going on almost everywhere in Europe, and ministers come and go exactly as in Greece. You mentioned electric chair. That's a good way to put it, or the catapult, you might say. Many ministers just bounce there in the seat and then disappear somewhere, promoted or the otherwise. But if you look upon a few characteristics of successful healthcare systems, to start with, closing the gap between doctors and patients. That's essential in a modern, well-serving healthcare system. It means that, for example, you allow patients to access information about their conditions, that you have full transparency in relation to the patient when it comes to medical records, for example. Still, it's not uncommon that it's complicated to take part of the information in your medical record. And that's important to active patients who want to have the full view, of course, to be able to understand what's in the medical record. Also, having access to a second opinion. If you're not satisfied with the decision or the ruling by your doctor, you should be able to have a say from another doctor and so on. It builds a platform of patient empowerment that's essential. Shared decision making, where you look upon the patient as a resource, not an object, but somebody who can help the doctor to make informed and wise decisions when it comes, or recommendations when it comes to the treatment. E-health, another part of this, we heard about e-prescriptions. That's important, but also that you allow the patient, for example, to make own bookings or appointment with a doctor. You can do that in simple electronic systems over the internet. And I will tell you about a successful example of that. And that means that you can, exactly as you do in modern banking, or when you book your flight ticket, for example, over the internet, you let the patient or the client, the customer, do parts of the work. And still, you have around Europe tens of thousands of nurses allocated to administrating these kind of things, booking appointments, etc. You could let the patients take care of that. That would rationalize and make the system much more productive. Corruption, last but not least, we notice when we do this measurement that in large part of Europe, surprisingly large part of Europe, this is a problem. Patients say when we ask for their view that, and we work together with more than 1,000 patient groups and patient organizations around Europe who have a say here. We consult them about our outcomes. They say that in Greece and many other countries, corruption is a problem. You have to pay the doctor under the table to be sure to have access to the best medication, or that you should get a quick treatment, etc. And of course, in a transparent, informed system where you have patients and doctors equal on the same level, that won't be sustainable. We measure, as I said, this is a special segment of our measurement, patient rights and information. And here you notice that Greece is in the absolute bottom. And when we asked patient organizations about how they looked upon the position of patients in each country, there were 3 countries that stick out: Greece, Ireland, and Spain, where you get an official view claiming that, oh yes, we have a patient right law, for example, and yes, patient can have access to their medical records and so on. Then when we ask the patients, they say there might be some law about it, we never heard about it, and nobody among patients really understand what the use of it, or it's very difficult to have access to your medical records. A doctor always wants to sit beside you, and etc., etc. You have no free access and so on. So 3 countries, among them Greece, are getting a red alert by patients here. And again, in modern system, this is essential to have a good relation and open accounting, so to say, in relation to the patient. Let's move on into a couple of more remarks here. Balance of how you use resources to keep costs in control and improve systems outcome is another essential thing. That you, as I went into a few minutes ago, that you try to build a coherent system, that you not spend too much money, too much personal resources on just a certain part of the healthcare system. And if you look upon what's especially remarkable when you take an outside look on Greek healthcare is the very high number of doctors and pharmacists. Greek is in the absolute lead in Europe when it comes to number of doctors in relation to the population. To the left, you notice, or the, let's say, the colored staples, the colored columns here, are the number of doctors per 100,000 inhabitants. And the yellow staples illustrate the number of visits by patients to doctors outside hospitals, to specialists or primary care doctors. And as you can see in general around Europe there are around 300 doctors per 100,000 patients. Most countries cope with that level and can provide good health care. In Greece, it's more than double. There are more than 600, or there were, I would say, 2012. Probably there been a reduction. We will see when we do our new 2015 study. But 2012 figures show the extreme number of doctors, and also goes for the number of pharmacists. If you relate the red, the Greek staple there to the right, the number of doctors to the production of meetings with patients, it's quite low. You notice that there are in roughly 4 visits paid by each patient in each citizen in Greece. That's from a European perspective rather low. You have some countries such as Czech Republic and Hungary and Slovakia. That's motivated by the old communist time generosity, where you said that if you visit your doctor, you will be able to take the whole day off with keeping your pay. So of course that's a strong financial incentive that evidently works. But if you look upon the average figure, you notice that in most countries you have between 4 and 6, 7.3 I think is an average, visits per year and per patient. In Greece it's 4, which is rather low. It's a little more than the extreme low Swedish condition. But what this tells us is that, or let's say it raises a question, what do Greek doctors do all day? They are very many, but they don't see very many patients. And what the pharmacists do, we know better. They sell a lot of drugs, which has been part of the Greek problem. The doctors maybe spend their days writing prescriptions, and that's part of the same story. But this again tells you something wrong in the system, and could be valuable information when you try to reform it. So, reduce the risk for drug overconsumption. That's also part of this successful example story. And the Greek per capita spend has been among the highest in Europe, and evidently that's not sustainable. And of course it's a matter of balancing when you start cutting down, as we heard from representatives from the pharmaceutical industry. You can be too aggressive in cutting down, of course, so you ignore very essential needs. But if you combine the high consumption with the high number of doctors and pharmacists, you get part of the explanation, I would say. You pay too much attention to that side of the healthcare, while you might have been ignoring prevention and access, for example. There are rather long waiting times in Greece, Greek healthcare and so on. So, but still, though these complications, you should see also light in the tunnel. Greek healthcare continued to improve, also during at least the initial parts of the financial crisis. Greece belonged to the green, good performance when it comes to infant death, for example. Find Greece in the middle of the green field. And when we started doing this ranking or measuring the infant mortality, the cutoff was 6 cases, 6 dead infants per 1,000 live birth. That was 10 years ago. Now the cutoff is down on 4, as you notice. And probably in a few years ahead, the best performers, the green segment, will down on the level of 3, and that's achievable also for Greece, I would say. So there's been an improvement. Also, the cancer survival, you find Greece second to the left, and also there in times of crisis, there have been an improvement in cancer survival, though there have been radical financial strain and cut down of medication. And when you look upon this picture, I'm close to the end now, you notice that compared to the traditional, the pattern we see now for many years, that Greece has been a very early adopter, quick implementing new drugs to often high costs. When it comes to key medications such as TNF inhibitors for arthritis medication, the arrow points to Greece now spending very little on this, maybe too little. But given the circumstances, of course, this break from being a high spender to a more reasonable spender is quite welcome. It got to be part of the solution. But again, we see a balanced use of also new innovative medicine as essential, of course. We often criticize countries that government delay the introduction of new drugs, denying people access to it, and or that it's put outside of the public subsidy and so on, meaning that it's hard to achieve for ordinary people. So it's a matter of balancing, but looking into the extreme, and somebody said we go moving from extremes. That's probably right, from being extreme high consumer, and now we're talking about all kind of consumption, privately paid, publicly funded, OTC, prescribed drugs. Greece has been a high spender, extreme high spender, and an early adopter, and now things are very different, and the trick will be, of course, to build something in the middle. So finally, for a new start, and I think this is a unique opportunity really to reform the Greek system, and I wish you all success in doing that. You can look to, I know that politically Macedonia is a sensitive issue in Greece, but it shouldn't prevent you from looking into what they're doing. This small poor country with much lower income level than Greece reforms its healthcare system now using e-health, especially in primary care, as an aggressive tool, achieving a lot when it comes to increasing productivity and access. Dutch patient rights, where you really look upon the patient as a resource, not a complication or a problem for healthcare, but a resource, somebody taking part in the decision making, as I said before. Transparency that you use in Denmark, for example, where you present to the audience, to the patients, all the opportunities, and they can make informed choices between hospitals and so on. Excellent access, I mentioned, not totally uncomplicated, but good overall, like in Belgium, where you quickly can access your doctor. And with this high number of doctors, of course, it's very strange that you have to wait for seeing a doctor. And last but not least, safeguarding essential public care, especially important in times of crisis. And the Czech Republic been quite good, for example. Overall, not very impressive performance, but stressing equality and equal access to care. Nothing of this really is costly, because when you talk to, which we do on a weekly basis, governments and health ministers, thinking about reform and having different kind of problems. You often hear, we can't afford that. That's not realistic to ask for when we have these kind of financial problems. But nothing of this really is costly. This kind of e-health system in Macedonia doesn't cost very much. Open up information systems cost very, very little compared to new hospitals and hiring large many new staff or buying new equipment. We don't talk about that. We're talking about basically building information systems here. So this is not really a matter of money, but it requires a radical shift of attitudes. And of course, that's more demanding. That's not a matter of the thickness of your wallet, but what's in your heart and what's in your brain. Does that motivate you really to take action? And I hope that in this time of financial and social crisis, really there will be a place in hearts and brains to take this kind of bold action. And you can read more about this. I have some additional slides at our website where all our studies are available. We've done 50 different kind of indices and we started, and everything is available for free at our website. So thank you very much.
Thank you very much. Thank you very much.